Welcome back to my channel. My name is Omalui and I'm glad you're here. If you're a new subscriber, thank you for watching, and please don't forget to subscribe, share and like our video. Support me as much as you can. On today's episode, I am excited to be chatting with Dr. Kawa here, and who is a family physician and also a psychiatric. So good morning, Dr. Kawa.
Good morning. I'm fine. How are you?
Fine, thank you. How are you doing today?
It's good.
Good?
Yes.
I'm glad you're here. Thank you so much for making it here.
No problem.
Tell us about yourself, please.
Yeah, my name is Kawa Ibrahim. I'm known in this area actually by Dr. Ibrahim, not my first name. I am Kurdish from the Kurdish part of Iraq, and immigrated to Canada as a refugee in 1991, and I settled in Edmonton, Alberta, and joined the University of Alberta for the first 2 years, and later I moved on to Saskatoon and Saskatchewan, and moving to Ontario.
That's interesting. You've lived almost all the cities in Canada. How has it been for you migrating from one city to another as an immigrant? How do you get to, meet people and socialize?
Yeah, I think as an immigrant, it's very difficult to come to a new country. And basically, as you know, possibly in your own country, we came from a big family.
Sure.
And now suddenly you are isolated. You feel like you have no one. And in a new country, you have to learn a new language. And the other issue is how you are going to survive. Like that's some issue which is very important. A lot of immigrants comes to this country, they have big hope and dreams, but when the reality hit, you have to start from the scratch.
Of course.
Just to let you know, I am a medical doctor and I'm a surgeon, and I wrote my medical exam in 5 countries.
Wow.
And in Canada, I have to wait for 7 years to get really back to practice medicine. I flipped hamburger. I work, low pay job. My first job in Canada was $700 in a month, which is like I had an apartment, but there was no furniture in it. Do you know what I mean? I have my dignity, so I didn't ask for help. I survived, but believe me, there was month which was not enough money left for food. So starting from scratch and living a very hard life, like as early, you mentioned that the immigrant have to work 2 jobs. That's what I did. I was a PhD student at the University of Alberta, and after 2 years, I couldn't work the whole night and study the whole day, and like there is so many hours in a day, and I have to leave the program after 2 years. So it is it's really difficult, and you have to be in a survival mode, but eventually you made it. Yeah.
Wow. That's just a typical story of immigrants. Like, it all has to be like this.
Yeah.
So how was it? You immigrated in Canada in 1991,
That's
right?
correct.
So how was it for you making that transition from a medical surgeon who is experienced and licensed in more than 2 countries, and now you have to flip burger because you're an immigrant in a brand new country? How was that experience?
It's tough, but you have to do what you have to do. Like it's the matter of dignity and the matter of principle, and be a resilience. Like what other options you have?
Minimum option.
Yeah, you have to do it. Yeah.
Wow. So now you're a psychiatric.
Yeah, I'm a family physician. I practice psychiatry full time, but I don't have a Royal College degree. But I am, like, for the last 22 years just practicing psychiatry, and I'm very successful in psychiatry actually in Kitchener-Waterloo, Cambridge area. I've been recognized as the top psychiatrist in this area, and I am very proud of my record. And of course, for me, mental health is all of us through our lifetime might go through some issue with the mental health, including our loved one too.
Sure.
And unfortunately, mental health patient is not treated as well as other patients. And sometimes they have been discriminated. So I have been very big advocate for the mental health patient and supportive of them. Like for the last 22 years, that has been my work in Saskatchewan and in Ontario.
Wow. So what are some of the things that you know has been like a trigger for immigrants, the mental health of immigrants?
Like trigger back home or in Canada?
In Canada, both maybe their, let's say, their ordeals or struggles back home and the new life they are trying to acclimate to here in Canada. What are some of the things that you've come to realize that is their common trigger that majority of immigrants, suffer or struggle with?
Yeah, I think one of them is the language barrier. Second of all is the cultural barrier. Like, different people came to Canada from different cultures. Sometimes they have really difficulty acclaim or, adapt to the new reality. And the other issue, which is a big issue, is financial issue, because the immigrants, not like any other Canadian, first or second generation Canadian, they have difficulty finding job, maintaining job. In addition to that, the majority of the immigrants coming from third world countries, they suffer from post-traumatic stress disorder. That's the guy or the woman which is, have flashback, nightmares. They avoid socializing. They are anxious. For them to find a job and maintaining a job is going really to be difficult. Most of them, after a while, they cannot work and they live in poverty. They are isolated. And my bigger concern is with the immigrant women and girls, because they are more isolated than the men and the boys in some culture. And I think the other challenge is the education. Because of language barrier, they cannot really go. Or someone have a degree like in medicine or at the law, they cannot complete their education in Canada because there is so much red tape and rule and regulation. They cannot go back into their original education.
Do you sometimes have immigrants, that are suffering or that are going through lots of depression and they are like, I can't cope, I want to go back home?
Oh yeah, absolutely. Oh, yeah, I think when we look, the prevalence of depression and anxiety, post-traumatic stress disorder is very, very common among immigrants and refugees, and they became homesick. But most of them, they cannot go back home.
Right.
So I think the rate of the suicide is high. So you have to figure out how you are going to help those immigrants. Again, I come back to the fact that the difficulty we have in Canada and the system, like we don't have a lot of social workers which they speak other languages, and those patients, they don't speak English very well. So that will be really a challenge to treat them.
As an immigrant who is now obviously a Canadian and you're practicing in the psychiatric field or mental health, you are an advocate of mental health. What are some differences that you've, been able to notice from, this is 2021, right?
Yeah.
So compared to being an immigrant in 1991, what are the gap that, some changes both in their social cultures, in the laws, challenges of immigrants?
I think the challenges, to be honest with you, remain the same.
Right.
I don't think in the last 30 years I have seen a lot of changes. I think there is a lot of work to be done, to be honest with you. I think the immigrant should get involved in politics and the government policies and to be part of the system, not outsider. Like right now, when you look at it, they are not part of the system.
Right.
And they have been alienated, and I think that has to be dealt with, because I think they should have a say in their own future and how to survive living in this country and to be part of this great country and this culture.
So tell me, what was your first culture shock experience?
I think back home you have only one kind of bread when you go, when I remember going to a fast food to have a breakfast, and the lady looking at me and saying, I need like an egg burger or something like that. I say, what kind of bread? And pausing for a minute, say, just it's a bread. Bread is bread.
Bread is right.
So she started, telling me different kind of bread. So I will stop here in the middle. I say that kind. Yeah. So I think our life back home was simpler.
Yeah.
Do you know what I mean?
Sure.
When,
straightforward.
Straightforward. Now here is more complicated or sophisticated.
Options.
I don't know how you. Yeah,
Unlimited
you have more
options.
options. That's true. So. Yeah. So with time, I learned actually to appreciate what we have here, and other options, as you mentioned, we have here, which back home we didn't have that.
So what are some of the advice that you give young immigrants that are coming into Canada, especially the ones that are professionals, let's say doctors, lawyers, engineers, before immigrating into Canada? What are some advice that you give them? Yeah,
to be resilient, not to give up. I think Canada is a great country. They have to really work hard, not to be shy away, to keep trying. They should consider themselves part of the system, not an outsider, and to work hard. To me, it doesn't matter how you make your living, as much as is with dignity. It doesn't matter if you make like $10 as a doctor, as a someone working at the McDonald's or working in a factory. It's about dignity. You want to work and you want to have a future, and you have to do it. I worked different job in Canada. I'm very proud of it, and I never look down on myself saying, you are a doctor, why you are working in a fast food.
Sure.
I never thought about it for a minute. Of course, there was challenges, like sometimes, people make statement, or there are people, they have prejudice. That shouldn't really affect you.
Right.
You should just, focus, move on, be resilient, and you get there.
On that note, I'd like to ask one more question.
Yes.
Most immigrants that come in as students, for example, and they'd like to one day be a physician, or they are working towards being a psychiatric.
Yeah.
So how long does that take to actualize?
Yeah, I think first of all they have to do their high school diploma. And after that, they have to go to the university. They need to have a very good mark to do the art of science, and then go to medicine, which is 4 years. And after that, specialize. I'll give you a story of my family. My niece, she is an eye surgeon. She came to Canada when she was in your daughter's age. And she graduated with honor at the University of Saskatchewan at science. Then she went to medical school. Then she went to Ottawa, accepted in residency as an eye specialist, and sponsored in the United States. She worked in Haiti and India as a volunteer. She's a young woman. She is like born, I think she's 29, 30 years old. And now she is a very good eye doctor located in Ottawa. So I think anyone which comes to this country could follow. Her name is Soline's, pathway, and move forward with their life. It's not impossible. Actually, a lot of immigrant children in this country, they are very, very successful.
Is there any advice or something that you'd like to share with our viewers?
Yeah, I think not to give up, to be resilient. To be honest with you, it's a great country, and Canada opened doors for so many immigrants from all over the world, and I think we have to be resilient, we have to be hardworking, and we have to be part of the society. That's another issue. You cannot isolate yourself.
You're a family man. What would you say are some of the challenges that families go through, especially immigrants who immigrate into Canada as families?
Yeah.
I'm sure you've had some patients,
Yeah.
you know, who are families or
Yeah.
maybe, you know, couples with a little child or children,
Yeah.
you know, and they come to you and they struggle. What are the common struggles that families go through in Canada?
Yeah, I think part of the struggle, which I see, at least in my practice, is cultural shock. Like the kids are the new generation and the parents are an older generation. Sometimes they don't accept that reality. So they want their kids to be like them or behave like them or behave the way they behave back home. I don't think that's going to happen. I think we have to have open dialogue and communication with our kids and not to impose any kind of cultural belief on them. Let them to be. Yeah. Let them to be free and decide what they want. Let us teach them dignity, how to, you know, how to be resilient, how to be honest, and so on. And the rest they have to decide. We are different generation, whether we like it or not. So sure. Our kids are going to be different.
Right. Thank you so much, Dr.
Oh, sure, no
for
problem.
coming and sharing your experiences,
yes.
your knowledge,
yes.
and all that you've shared with us.
Oh, sure. Thank you for having me.
Thanks. And thank you so much for staying by and watching with us. Please don't forget to like, share, and subscribe to our channel. And that's it from us on this episode. Thank you for watching. Bye now.